So along with the greetings, now we have another frequently asked question, usually among the Rasa Vaidyas, wherein there are many controversies stating like, does really metals and minerals used in Rasashastra have Rasa, Guna, Veerya, Vipaka, etc. or no? People are so much worried about whether really Rasashastra falls into the normal set of criteria which is usually being considered into Ayurveda, because everything is said to be believed as Rasa, Guna, Veerya, Vipaka or the main sources for the therapeutics. If at all the Rasa medicines are being equated as some other set of medicines other than that of Ayurveda, because they don't fall into the Rasa, Guna, Veerya, Vipaka and all. I do have certain set of colleagues or known people wherein they strongly believe, stating like Rasashastra doesn't belong to Ayurveda at all. Yes, you have heard it right. There are certain people who claim Rasashastra is a different entity. It's a different medical entity. It's not related to the umbrella of Ayurveda, just because of the reason the metals and minerals whichever are being used doesn't significantly consider the Rasa, Guna, Veerya, Vipaka, etc. Especially in a clinical protocol, just because of the reason there are a couple of references. Possibly we have na doshanam, na deshanam, so wherein the Acharya has asked us not to consider about the Rasa, Guna or Desha, Kala, anything while administering with that of the rasoushadhis. So with this particular criteria, there are people who claim, stating like, no, Rasashastra should not be included in Ayurveda because all Ayurvedic drugs do have Rasa, Guna, Veerya, Vipaka, whereas the Rasa Dravyas are not having them. So the answer is, the way how they have understood that is a myth. It's a fault. The way how the people have understood the whole science is a total different entity. There are certain Vaidyas, most popular Vaidyas, who have even claimed me, stating like, even when it is being practiced, say for example, Mrityunjaya Rasa, what Rasa, Guna, Veerya, Vipaka does it has to treat it on cases of like Jwara? No, absolutely no. You are giving some patient with that of something like Arshakutara Rasa, or you are giving Ananda Bhairava Rasa or anything to the patient. Does it have Kashaya Rasa to do the Stambhana action? No. Then how is that you want to believe like Rasashastra is something related to that of Ayurveda? It's a different entity. My answer to all my friends of those categories wherein they have this frequently asked question in the Rasashastra, among the classroom teachings in Rasashastra, is definitely yes. We never go to understand those concepts clinically oriented, because you cannot enumerate them on the textual grounds. I can never say that Parada is Madhura Rasa. I can never say that Gandhaka is Katu Rasa. I can never say like Tamra is Tikta Rasa. Definitely no. Why? Because I very strongly believe in the context of Samskaram Gunantaradhanam as claimed by Acharya Charaka to the Kaya Sampradaya of Ayurveda, wherein he claimed his knowledge inbuilt in this particular shloka, stating like all the processings, the pharmaceutical processings will engrave a different sort of therapeutic action of the drug, and he named it as a Samskaram Gunantaradhanam. When I take Kumari and I do Bhavana with Chitraka, Chitraka is Ushnavirya, it is more of Pachana in quality, it is more of Dipana in quality. When I take Kumari to that and give Bhavana, will that Ushna become Shita there? I don't know. Might be it's moderated, but it's not converted. It's been moderated, that's it. So, but in Rasashastra, it happens like I can make Pravala Pishti, which is considered as a Shita Virya, when I triturate it with rose water and make it as Shita Veerya Dravya, the same Pravala Pishti, when I triturate it with Snuhi Kshira and I process it, then it becomes Ushna Veerya. It's totally contradicting between Ushna Veerya and Shita Veerya. Then how can I claim an SOP on that? How can a Acharya claim a particular drug like Swarnamakshika is so, Tamra is so? And based on that I cannot go for the treatment. So this particular shloka, which many of the people haven't read the shlokas prior to that and after that, they take something like on a selective criteria, might be I take it as a selective blindness for not reading the other shlokas. A very small piece of the shloka was being read out and they have claimed it stating like, Rasa people don't think about the Rasa guna veerya vipaka. Definitely yes, again I speak about my statement. Just because of the reason, say for example Swarnamakshika, say for example Tamra, say for example Swarna. The same textbook which has explained in the Bhasma Siddhi Lakshanas has said aswadu, means it should not have any taste. The Bhasma should not have any taste. Means when I put a small quantity of Bhasma into my tongue, on my tongue, it should not percept any sort of taste. It should not be madhura, it should not be amla, lavana, katu, tikta, kashaya. Then I consider one of the Bhasma Siddhi Lakshanas. So Rasashastra doesn't belong to Ayurveda. Again I say, lol, just laugh at the event. Because Rasashastra believes in the therapeutic action of the drug. It's not only on the physical rasa guna veerya vipaka what you are appreciating, it's on the therapeutic processing. When I say particular drug is madhura rasa, it is therapeutically madhura. Not literally madhura, by tasting it, it's not sweet in taste. But it is therapeutically madhura rasa. It is definitely ahalladakara. It is definitely having its own significance. It is therapeutically appreciated and this is being approved by the people who are into the rasa practice. But when I want to administer, I need not consider it. So the statement which I have claimed, the statement which they could understand is the same, but they understood it in a lesser way. I am trying to make it to understand it in a grosser sense, in a bigger sense. Just because of the reason, when I give a particular dravya, a particular bhasma, say for example it is having madhura rasa, and administer it to the patient who is suffering from madhumeha, his glycemic index is not going to build up. This is for sure. This is the fancy of rasa practice. But definitely the guna karmas of the madhura rasa, whatever the therapeutic attributes of the madhura rasa, which is being explained in the textbook of Dravya Guna, is being appreciated in the patient by administering these dravyas of Rasashastra, which is having madhura rasa, but they don't percept on your tongue having a sweet taste. So this is the way how it can be done. The second phenomenon, if I want, I can change the guna or veerya of that particular drug by changing the bhavana dravya, by processing it with various. Let us try to see what does the text say or what are the clinical experiences have taught us. To sum up in brief, my clinical experiences have taught me to the way how the textbook has tried to infer. I try to utilize them. I try to give the drugs which are said to be of madhura rasa as per the textbook to the patient suffering from madhumeha, clinically take the benefit of all the madhura rasas if I find it is essential in a patient, but I don't want to increase his glycemic index because they are not sweet in taste. I'm not giving him some drugs like Chyawanprash. I'm trying, because by taking Chyawanprash the possibilities like his glycemic profile might rise. But it doesn't happen by giving a drug like Vasanta Kusumakara, even though it is Madhura Rasa. So this is the way how the difference between the Rasa practice and Bheshaja practice happens. It's not the Taratama Bhavas of the clinical practice, it is a different style of clinical practice, that's it. Both are highly appreciable. Both are therapeutically active. But the way of practice is different. There is no sense in discriminating the departments, the way how we need to practice. So this is how we need to go with in respect to the clinical experiences. But what does the textbook speaks about? Does the textbook believes the same way as what I have explained? Let us try to see hundreds of such examples from the textbooks. I don't say a couple of examples from the textbook. I use the term called as hundreds of examples from the textbook, wherein the same textbooks where they have referred for the shloka as where Rasashastra doesn't believe in rasa, guna, veerya, vipaka, states itself like a set of madhura rasa, a set of amla rasa, a set of tikta rasa dravyas, attributed their qualities in the textbooks. Amla rasa set of drugs, you can see the drugs like makshika, kasisa, spatika, rajata, tamra, vartaloha, gomedha, vaidurya. These are the second column what you can see. It's totally about the list of textbooks, chapter number and shloka number. So this is how most of the protocols will go with. So there is nothing called as rasa, guna, veerya, vipaka. He categorizes it as amla rasa. Similarly, for the kashaya rasa, you can see the abraka, makshika, tuttha, karpara, gairika as a set of drugs which can be given in case if you would like to have the therapeutic benefits of the kashaya rasa in a clinical perspective. Similarly, you have other drugs to the same category as kasisa, spatika, haratala, shrotanjana, sauviranjana, kankushta, hingula, swarna, rajata, tamra. Again tamra, kantaloha, mandura, vanga, jasada, kansya, pairojaka. Katurasa, in case if you would like to prescribe or the set of drugs which belongs to the katurasa or shilajatu, karpasa, gandhaka, spatika, haratala, manashila, rasanjana, kankushta, kampilaka, hingula, tamra. Jasada, vartaloha, rajavarta, shankha, tankana, langali, kunja, datura, ballataka, vishatinduka, vatsanaba. So these are the other drugs belonging to the same category. For the lavana rasa, pittala is an example what we have. Of course, the whole lavana varga dravyas is lavana rasa, whereas the pittala is other substance as per Ayurveda Prakasha, 4th chapter, 73rd shloka. For the Madhura Rasa Sevana, wherever you want to have the therapeutic benefits of Madhura Rasa, try to administer them with that of Abraka, Makshika, Tuttha, Gandhaka, Gairika, Shrotanjana, Sauviranjana, Swarna. So there are a set of Madhura Dravyas which can be prescribed to the patients wherever you want to have the Madhura Rasa to be incorporated for their therapeutic benefits. The other Madhura Rasa Dravyas are the Abraka, Makshika, Tutta, Gandhaka, Gairika, Srotanjana, Sauviranjana, Swarna, Rajata. Again we have like Tamra, Kantaloha, Naga, Manikya, Mauktika Shukti, Pravala, Panna and Vaidurya. Spatikamani, Pairojaka, Dugdha Pashana, Katika, Gunja. The drugs which are having Shad Rasas, where it can be given as Sarvottama Rasayanas or the Vaikranta and Vajra, as per the reference of Ayurveda Prakasha and Rasa Tarangini. Or these many examples of nearly I have quoted more than 100 references. Is this not sufficient for us to understand? The concept of Rasa was known to the Rasa scholars, for the Rasa Acharyas, wherein they could incorporate them into their clinical practice and try to attribute it into the textbook. But this sort of discrimination is intolerable, wherein they state such a basic ideology like Rasashastra doesn't belong to Ayurveda. A set of drugs which can be given as a Shita Veerya, like you have the Abraka, Karpara, you have Gairika, Kasisa, Shraviranjana, Shrotanjana, Pushpanjana, Murdhara Shringa. Swarna, Rajata, Tamra, Kantaloha, Mandura, Vanga, Jasada, Pittala, Vartaloha, Mauktika Shukti, Pravala, Panna. Pushyaraga, Vaidurya, Rajavarta, Chandrakanta, Spatikamani, Pairojaka, Dugdha Pashana, Godanti, Shankha. Shankha and along with that Katika are also a few more examples wherein they belong to the same category. In case if you want with that of the Sniktha Guna, I have given just one or two examples here and there, but for that one or two examples I have hundreds of examples from the various textbooks of the various drugs which can be incorporated into the clinical practice. So we have the drugs like Abraka, Vimala, Chapala, Gairika, Spatika, Haratala, Manashila, Shrotanjana, Saviranjana, Neelanjana, Gauri Pashana, Navasadara, Swarna, Rajata, Naga, Manikya, Chandrakanta, Arkakshira. Similarly, in case if you want anywhere to incorporate the Tikta Rasas, we can prescribe them with that of the Makshika, Shilajatu, Gandhaka, Kasisa, Spatika, Haratala, Manashila, Rasanjana, Kankushta, Hingula, Swarna, Tamra, Kantaloha, Vanga, Naga, Jasada, Pittala, Kamsya, Rajavarta. In case if I want a set of drugs with Ushna Veerya, we can have enormous, huge number of drugs for this category. Because Samskaram Gudantaradhanam, you give so much of heat treatment to so many drugs. Ushna Guna becomes an inbuilt quality in so many drugs. But still, as per the textbook for the drugs as it is, we have the Ushna Veerya set of drugs as Shilajatu, Chapala, Gandhaka, Kasisa, Spatika, Haratala, Manashila, Rasanjana, Kankushta, Kampilaka, Navasadara, Varatika, Tamra, Vanga, Naga, Pittala, Kansya, Gomeda, Vaidurya, Suryakanta, Dugdha Pashana. Tankana, Langali, Dathura, Vishatinduka, Arkakshira, Vatsanava. Are these examples not sufficient to make us to understand the various drugs, however they are being explained, to make us to know about the Rasa Acharyas knew about the Rasa, Guna, Veerya, Vipaka, Swabhava and Prabhava. After all, for the people who don't believe in this context of Rasa, Guna, Veerya, Vipaka, don't you have some drugs which is being explained from our textbooks, something called as Swabhava and Prabhava? Are we supposed to delete them? Do we have the context of the set of drugs which are belonging to the Vichitra Pratyarabdha? Are we supposed to oversight them? Does our Acharyas believe in this context? In case the same therapeutic indexes as you have the Jwara, Atisara, Grahani, Pakshagata, Vata Vyadhi, whatever the disorders which is being explained in Ayurveda, the similar set of disorders are also being explained in the treatment protocols of that of Rasa textbooks. So don't you find something like these therapeutic indices, this therapeutic index of all the drugs should be treated in the various clinical conditions? Should they be taken as a criteria for the therapeutic management? The only way how it is not to be taken into consideration is they could not be the same. They can be manipulated. They can be changed. That is the reason why the Acharyas from the recent generation have claimed like you cannot frame an SOP for it. Pravala Pishti need not always be Shita Veerya. It could be Ushna Veerya as well. It depends on how you go for your clinical practice, how you go for your pharmaceutical practice. So this is how we go with the management of the various clinical conditions, especially with that of the Rasa practice. And unless and until we understand this context, this particular concept of the frequently asked questions, we cannot really understand the whole context of Rasa practice. We need to digest this particular aspect in this particular way and try to analyze the things and try to go with it. That is how we can maintain homeostasis and a way of understanding the subject in a proper way. So thank you very much for this opportunity for discussing with the topics of these kinds. Thank you.